In this day and age of super secure email, why would an administrator actually want to talk to you? Well, it's possible that they want to ask you to do something sketchy, but they don't want to leave any evidence that they asked you. So they talk to you by voice call or in person. Let's tell a story. You're working one night and you treat a teenage girl who got really drunk at a big party. She's okay, but when she sobers up, you and the nurse privately ask her if anyone might have assaulted her, and she says no, but then immediately bursts into tears and refuses an exam and insists on leaving immediately with her mean parents. You're left wondering, was she assaulted? Was she just embarrassed? Was it both? Since you don't really know, you just give her a diagnosis of alcohol intoxication, but you write down what happened in your note. A few days later, your department administrator calls you on the phone. Turns out the party was thrown by Mr. and Mrs. Big Shot on the hospital board. Your administrator says, "You can leave in her denial, but you should probably take out the part about her crying. It's needlessly suggestive and has nothing to do with her medical diagnosis." Now what do? It's easy to refuse a request that's clearly evil or illegal, but it's a lot tougher when you don't really know what happened or what's going to happen. You've got a few options. You could say, "Okay, I'll change my note," or "Send me a secure email requesting the change and I'll consider it," or "No, I won't." Your problem is that administration only wants you to pick option 1 because any edit or deletion can still be found on a forensic review of an electronic medical record. If you change things, the risk of discovery is lower, but the consequences if you are discovered are way higher. With this tactic, management's goal is to reduce the risk of discovery to the hospital, while ensuring that any increased consequences are paid by you and you alone. What's this mean? Well, suppose you make this change to the chart, but a week later the patient states that she was assaulted. If her lawyers aren't so great, they might just glance at the chart and decide there's nothing there. This is what your administrators are hoping for. But they also know that if your lawyer is good, they may order a forensic review of the chart and discover what you originally wrote and then deleted. This looks bad. You had no idea this was going to happen, but the patient's lawyer will make the most of it. And if this happens, your administrators want to be able to say, "We knew nothing about this. That change was his idea. There is no evidence we ever asked." So they don't get in trouble and only you look creepy and evil. What about the other two choices? Your administrators might give in, but they might also play the old game of "you'll beat the rap, but you won't beat the ride." This term comes from a police tactic where they'll arrest someone who isn't really doing anything illegal, but they'll handcuff them and they'll take them to jail and they'll make them stay in a cell overnight and then the next day drop all the charges and finally let them go. It's a way to harass someone you don't like. In medicine, it works this way. "Come to a meeting with me about that chart issue. Now go to another meeting with risk management on your day off. Now take this tedious webinar because we're punishing you for not doing what we wanted, but we'll never admit it." It's all about just wearing you down. Are there no good options? Well, there is one. I call it the opossum option because it involves appearing helpless as a way of protecting yourself. So, for example, when you get that sketchy phone call, agree to make the change. If possible, take a screenshot of your recent calls activity and save it. Then go into the chart and find the passage they want you to change. Underneath it, write a little addendum saying that you're doing this at the request of an administrator. Sign the note so the information is saved. After a minute, go back into the note and then change the parts they want you to change and also delete your addendum. Sign the note one last time. Don't worry, all that information is still in there. Lastly, send a clueless grandma-style email back to the administrator who made the request, saying, "Hey, I did it, I took out the stuff about her crying." Be sure to CC a friend and maybe yourself and save a copy. Now, if there's a forensic chart review, they'll find your original note, but also the addendum saying that an administrator asked you to change the note. If you combine this with the email that you sent and/or the screenshot that you took, you have pretty solid evidence about what really happened. You won't look like an angel, but some headlines are less awful than others. Which of these news headlines would you rather be a part of? Does all this feel a little sleazy to you? Good. We all dream about being in the middle of black and white situations, but in the gray of the real world, we often don't know the truth. So we need to find a system of moral compromise that lets you honor your obligations to your patients, your job, and yourself, even if, and especially if, someone only wants you to do what's best for them.